What's up, y'all? It's your girl CC Brown, and welcome back to my channel. If you are new, go ahead and hit that subscribe button right now. And if you're not new, then welcome back. So as you can tell by the title, I will be talking about why I stopped working as a CNA. So working as a CNA, if you don't know what a CNA is, CNA is a certified nursing assistant. Most CNAs work in nursing homes. They can work in hospitals. They do home health, and some CNAs may work in a doctor's office. But however, my CNA experience has been very, very challenging. I'm gonna say challenging. The reason why I stopped working as a CNA is because, one, low pay. The pay is so low for CNA work, and I don't understand why. We do so much. And keep in mind, I still have my CNA license. I work PRN as a CNA, which is probably once every 2 months, just to keep my license, active. But the CNA pay rate is so low. It's literally so low. When I first got my CNA job, they paid me $10.75 an hour. This was back in 2014 though. $10.75 an hour. The lowest someone tried to pay me for CNA work was $8.50. I made more than that working at CVS. I was making $9. Amazon even paid more than CNA work. Like I said, I work at Amazon on the weekends, and they're paying me $19. I never made $19 working as a CNA, and it's really messed up because you're taking care of human beings. And at Amazon, I'm scanning boxes. Human beings, boxes. But you mean to tell me I went to school for a month to get less pay? And I have to go to school for Amazon and I get more pay. Why is that? Why is CNA pay so low? The highest I ever made working as a CNA, I made $15. That's the highest I ever made. Even with home health care, this man, he called me. He was like, yeah, we need a CNA. And I was like, is y'all gonna pay $12? He was like, no, we pay $11. And I was like, I'm sorry, I'm not interested. As far as CNA pay should start off at $15. Especially working in a nursing home. Matter of fact, it should be $17. Especially working in a nursing home. It's not right. It's not right at all. Comment down below how much you made as a CNA, because I want to know. You can probably be in a different state than me, but comment down below. But the pay. Number 2, the way you get treated as a CNA. You get treated like they belittle you. The family yell at you, the nurses, the doctors, the patients. You get belittled like you are nothing. You are at the bottom. They make you feel like you are at the bottom of the barrel, when actually you at the top, because you are helping the residents. But that's how they make you feel. They make you feel that way, and then everything is blamed on you because you are hands-on with the resident. And it kind of made me mad, because it's the fact that CNA work is very, very intensive, if that's the word, intensive. Working it can be stressful too as well. I remember when I was working at CNA, I dropped the patient, the accident. I felt so bad that whole entire day. It really did. Because that's a human being. You know what I'm saying? That's a human. And she was older. And I felt so bad when I was transferring her in her wheelchair. She slipped and fell, and she got dropped. And I felt so bad. And that was on my heart and my mind. Even though it was an accident, I felt so bad. Versus me working at Amazon, I drop a box. Oh, it's a box. It might be something in it. It's probably broke, but it's something that you can remake. Versus if I drop a resident and they hit their head or something happened, then the person did, and you have to have that on your conscience. Another thing is, CNA work is very physical. Very, very physical. And sometimes there will be a shortage because other CNAs don't come to work. Your other co-workers might not come to work, and you have like 17 or 18 20 patients that you have to take care of. Can you imagine taking care of 20 patients? You are not giving them the full total care, because within an 8-hour shift, or shoot, even a 12-hour shift, do you know how hard it is to take care of 20 patients? You are not really giving them the full care. You only can give them the bare minimum, because you have so many patients. And I never will understand that in a nursing home. Why not be overstaffed instead of understaffed? Hire every single day. I know people won't quit because it is a hard job, but y'all need to be having orientations every single week, so that way you can have stays or have a big PRN pool, so that way other CNAs won't feel overworked or burnt out. I'd rather for a facility be overstaffed than understaffed, because at the end of the day, you want your CNAs to feel appreciated. I never worked at a facility that was, I did work at a facility that was overstaffed, and that was assisted living. But then they realized, oh, we used to have, like 2 CNAs or 2 hall, had 8 residents. We had 4 residents apiece, and we used to work together. But then they realized, oh no, let's just make them have 1 CNA on this hall so they can make more money. This is a business, and they're all about the money. It's all about the money. So they don't care about you. These nursing homes do not care. It's all about the money. It's a business. It's a business. And the thing is, I like taking care of people. I do. But it can become very overwhelming when you have so many patients. It make you not even want to do the job no more. And people need care. People need to be taken care of. They need this. You have total residents not getting the proper care because their CNAs are overstaffed and can't get no help. The nurses sometimes, well, not all nurses, but some nurses, they don't even want to help you. They don't even want to help put the resident on the bedpan because they too good for that. That's why I said when I become a nurse, I will never be that type of nurse. Never be no lazy nurse. Never want to help. No. This is why I'm going to become a nurse. Now, if Cna Pay was more and we wasn't so understaffed, I would probably still work as a CNA. However, I cannot live off Cna Pay, and I cannot work myself to death like that. I refuse to. So therefore, that's why I'm going back to school to become a nurse. It's sad because I'd rather work at Amazon than work as a CNA, which is sad. Now, home health care is another story. I like home health as well. However, it's not reliable because I had a patient that I like going to, and they decided they didn't want our services no more. So I was out of a job, and I had to find another one to go to. So with that being said, I understand being a CNA is difficult, and I advise anyone to go ahead and get your CNA and work as a CNA PRN, just to keep things active, because you are helping people. I know it's hard, but you are actually helping someone. I know, because I've been a CNA. I had my CNA license since 2014, so it's been a minute. Do I work full-time as a CNA? No, I would not. It's sad. I would not recommend no one to work full-time as a CNA. Part-time, yes. PRN, yes. Full-time, no. Get out while you can. Get out. Like that movie, Get Out. I'm sorry, y'all. But I know some CNAs have been in CNAs for 25 years and they just used to it. This is what they do. But CC Brown can't do it. Shout out to all the CNAs. Shout out to myself. And I think it was Certified Nursing Assistant Week last week, or was it this week? Anyways, happy Nursing Assistant Week, whatever week it was, this week or last week. I know it was one of the weeks. But anyways, y'all, this was just a short video. Comment down below if you are a CNA. Shout out to y'all. I appreciate y'all. I appreciate myself too, because I am a CNA as well. Anyways, y'all, it's your girl CC Brown, and I'm out. Peace.